Risky, risky, wiggy, wiggy, this is an emergency. Ni hao y'all, Tommy here, and today I'm going to be talking about my jaw surgery experience and recovery while eating Korean fire noodles. I actually already made them. So I also topped them off with some corn cheese and a fried egg, as well as I used this ajinori furikake. It's basically the same as the roasted sesame seeds and seaweed you get in the packet, but I kind of like this stuff better. Oh, and got myself a Dr. Pepper, a drink for intellectuals. Let me open this up. Alright, but let's dig in first. This was a lot better than I expected. I usually top off my fire noodles with mozzarella cheese anyway, but using that mozzarella cheese to make corn cheese and putting it on top was like an extra step that was definitely worth it. I think the spice level is tolerable for me. Although I remember when I first tried the challenge way back in like high school, I definitely couldn't handle the spice. But I did remember like thinking it tasted really good, which it does. So I wanted to make this video as kind of a way to give back to the whole jaw surgery community. When I was getting ready for jaw surgery, I watched a lot of other people's vlogs about their experiences, and that really helped me mentally prepare myself for the whole recovery process and everything. So if you're about to get jaw surgery or already in recovery, I really hope this is of some help to you. If you're not, but you know someone who is, then do consider sharing this video with them. After finally getting insurance approval for the jaw surgery, I was finally able to start the planning process. It's pretty simple on the patient's end, just taking before photos, imaging, and getting molds and guides made. Then the surgeon will pretty much plan out the rest. When it was finally day of the surgery, I wasn't all that nervous. Like, I was in good hands, and I was just kind of ready to get the whole sleep apnea thing over with. I was really just tired of being tired. So the surgery was on August 7th, 2020, I think at 9 a.m. So my dad drove me to the hospital, and then I just signed in. They took me into my like private waiting room where I was able to change it to my gown and basically just chill in bed until it was time for the surgery. But the doctors and nurses will pop in from time to time just to double check everything, make sure you're doing okay. And once they were done double checking everything, I was taken to the OR, but I think they might have started the anesthesia like on the way there, because that's pretty much the last thing I really remember. The surgery set out to cure my sleep apnea. So both my jaws were cut and then rotated and moved forward, then finally secured with titanium plates and screws. I'll put an x-ray too. I believe the full name of the surgery was Maxillomandibular Advancement with a Lefort 1 osteotomy, inverted L osteotomy with bone graft, a genioplasty, and I also had surgical braces put on. I'll break that down for you. So maxillomandibular advancement means double jaw surgery. Your top jaw is the maxilla, your bottom jaw is the mandible. Lefort 1 osteotomy is the cut for the top jaw. I think the one means that there's just one cut all the way through, or it might mean that your upper jaw is like in one piece. That's my favorite manga, by the way. The inverted L osteotomy is the cut for the lower jaw. You can kind of see how it's shaped into like an upside down L. And then there was also bone graft placed where that kind of empty black space is, because there wasn't really a bone connection. The genioplasty is the chin surgery, and then the surgical braces are there for you to put rubber bands on. So they go right above and below your teeth on your gums, and there's like little notches for them to put rubber bands on. The surgery was planned for 8 hours, but it ended up taking 13, so it was a really long surgery. And since it was so long, they had to put a catheter up my urethra, and it's not pleasant. Like, well, they put it in and take it out while you're unconscious, but it'll burn when you pee for a couple of days. And after surgery, I stayed in the hospital for 2 days, I think, before being able to go home. And so I guess this is the start of the whole recovery process. And, well, recovery was tough to say the least. Especially I think the first 3 weeks were particularly rough. You'll probably need someone to take care of you for a couple of days right after surgery. Probably the first 4 or 5 days maybe. Even though the recovery was a challenge, it was all worth it in the end. But if you ever find yourself feeling overwhelmed, then remember our Dubu Queen Kim Daeon's motto, "This too shall pass." I kind of wish I actually documented my recovery journey, but I hadn't really decided to pursue YouTube yet. So the rest of this probably won't have any pictures, and you're gonna have to take my word for it. So after waking up from surgery, you'll notice that you're really swollen, but don't worry, it gets worse. There's a lot of trauma that happens to your face during the procedure, so it's pretty natural to be really, really swollen. But it will get worse and peak at around day 4 or 5. It was day 4 for me. And well, I was so swollen that I couldn't close my lips, so I ended up drooling a lot. But after it peaks, it drops off pretty fast. I think at day 6, I was able to close my lips and not drool everywhere. After 2 weeks, a lot of it was already gone, and then I think after a month, I pretty much look how I do now. I just kind of have a little bit of residual swelling around here and here. You may also have some bruising on your face, but it was pretty minimal for me, so I didn't really notice it. I should probably finish these noodles before they get cold. That was really good though. I'm gonna go quickly do these dishes and probably grab some ice cream. Alright, got my ice cream, green tea again, but Dang, those noodles were so good. Kind of surprised myself. I would consider these my second favorite instant ramen, but with that corn cheese though, oh, might be taking over that mi goreng. After surgery, you'll also notice that your face is really numb. There's a lot of nerves in your face, so it's kind of inevitable that some will get severed, but in most cases it'll heal and you'll regain feeling. For me, it was my upper lip, lower lip, and chin areas that were numb. The upper lip area was somewhat numb, but the lower lip and chin were pretty much completely numb. I was able to slowly regain feeling over time. I think it took 2 months for me to regain feeling. I still have a little bit of tingliness to the touch, but I only really ever notice it when I'm looking out for it. You shouldn't expect to be like healed up like that in 2 months. That was like pretty fast. Regaining feeling in your chin at least takes most people 6 to 12 months, but there are some cases where people actually don't regain that feeling, and even if you don't, I still think the surgery is worth it. Most people will tell you that they experience little to no pain, but that wasn't really the case for me. I was in quite a bit of pain. It was more of a achy, dull pain, but it was pretty much all over my face. I was on some pretty strong pain meds, and I was taking them every 6 hours as prescribed, but it wasn't really enough, so I had to also take ibuprofen in between doses. But I think after 10 or so days, I was able to start transitioning to weaker medicine, and around 3 weeks in, I pretty much was able to stop taking pain meds completely, or I would just take it as needed. You may also have some trouble breathing after surgery, especially if you have the surgery done on your upper jaw. When you cut and move your upper jaw, it can move the base of your nasal cavity, and that will cause a lot of bleeding inside, and you'll often have dried blood in your nose. And on top of that, you can't really open your mouth. You may have heard people talk about how they've been rubber banded shut or wired shut. Well, I actually don't think they use wires nowadays, but definitely rubber bands still. They kind of keep your bite in place, and I guess it does make it harder to open your mouth, but I guess in my case I wasn't really able to open my mouth that far anyway, so it wasn't too big of a deal. It was more of them getting in the way while I was brushing my teeth, because I couldn't take them off for the first 2 weeks because I still had a bit too much swelling. Do your best to keep your mouth clean though, because if you get an infection, you might have to go back and get your incisions reopened and cleaned, and possibly a plate or screw replaced. But yeah, after 2 weeks, I was able to start changing out my rubber bands, and I could take them off whenever I was eating or needed to brush my teeth. And it definitely felt good to finally be able to brush my teeth properly again. Although I still couldn't open my mouth wide enough to get to the crowns of my teeth and the inside of my teeth for a while. I got there eventually though. I guess to elaborate on the whole eating thing, it wasn't really eating at first. So jaw surgery is pretty intense. Like, they're cutting your jaws and moving them. You won't be able to use your jaws properly for a while, and that means no chewing. Yeah, I was put on a liquid diet for 6 weeks. I've seen people who've been put on liquid diets for less. Lucky them. A liquid diet's not very fun. You're mostly drinking soup and shakes. But after those 6 weeks were up, I was able to started eating soft foods, and kind of been slowly working my way up. Right now I'm almost 5 months post-op, can't quite chew properly. I can somewhat chew with my molars, but I can't really bite into anything super well. But you really have to be patient with it, because if you try chewing too hard too early, you could fracture your jaw. So when you bite down, the temporal muscles will pull on your jaw, and since it's pretty weak after surgery, it can cause it to fracture. I actually did end up fracturing both sides, but not because I was chewing too hard, but because I was grinding my teeth at night. So if you grind your teeth at night and are about to get jaw surgery, you should probably let your surgeon know. I should have told mine, but I didn't really think about it. I guess back to the liquid diet and soft foods diet, you can expect to lose quite a bit of weight from it. Although I lost probably more weight than most people would. I lost 40 pounds or 18 kilograms. Well, that's probably due to the fact that the surgery cured my sleep apnea. So when you have sleep apnea, you're pretty sleep deprived, and I believe long-term sleep deprivation is associated with decreased levels of leptin and increased levels of ghrelin, which are the appetite suppressing hormone and appetite stimulating hormone respectively. And when those two hormones are kind of thrown off like that, you're prone to overeating. And that was probably what was going on with me before surgery. And now I don't really find myself overeating, and that's probably why I lost so much weight. But sadly, I probably won't be able to destroy all-you-can-eat Korean barbecue anymore. I guess some extra little things. Your lips will be really, really chapped. During surgery, they have to keep your mouth open, and they'll be stretching your lips so they can, see inside your mouth. And for some reason, I was also really, really thirsty while I was recovering. Like, I would drink probably like a gallon of water a day, or about 4 liters of water, and I would still be thirsty like all the time. That pretty much wraps up my whole experience with jaw surgery and the recovery process. So I hope this was of some help to you. But remember, everyone heals differently, so my experience may not reflect directly one-to-one with your experience. I'll do my best to answer any questions y'all have in the comments, but I would also advise you to talk with your doctor. I'll leave my surgeon, Dr. Huang's, information in the description in case y'all are in Houston and need a jaw surgeon. For my next video, I'll be talking about some tips and tricks that helped make my recovery a bit easier. But that's all I have for today. Thank you for watching, and I'll see you later.